So I want to talk to you about TMJ pain and the acronym we use. That's a pretty dumb acronym because it doesn't spell a word, but it gets the job done, and that is RTTPB. And so oftentimes a lot of our TMJ pain, you definitely want to see specialists to kind of help really fine tune things, but in general, you're either stiff or you're too mobile. And then in general with that, a lot of our pain comes from the muscle tension. And so if you're stiff, normal opening is 45 millimeters for men, 40 millimeters for women, so 4.5 centimeters, 4 centimeters. So you could have a friend help you measure. In general, 3 fingers is gonna be like, yeah, pretty close to that. And so the idea would be that you would open your mouth. If you can fit about your 3 fingers, that's usually pretty close to what you're looking for. So if you can open way more than that, you're probably on the hypermobile side. If you're nowhere close to that, 2 fingers or less, then you're on the stiff side. And sometimes your stiffness is limited by your pain. And then if you can't even open past finger width, so if you can't open more than 20 millimeters or 2 centimeters, then I'm certainly not diagnosing it, but there is a chance you could have an anterior disc displacement, and I would definitely recommend seeing a local physical therapist that specializes in TMJ treatment for that. So that's general, but in general, it's that muscle tension. And so the RTTPB is really helping you relax that muscle tension, whether it's one side or both sides. And so the R is relax. And so really just related to stress management, all of that, just finding time to relax. Our breathing we'll talk about at the end helps kind of, relax as well. But just checking in with muscle tension, and just like we could make a fist or be tight in our neck when we're stressed out or have tension, same thing with our jaw muscles. Some other strategies to help you relax are the next one. So the first T is teeth. Are they clenched? And so if you're clenching your teeth, that's like making a fist, and you can appreciate if you're making a fist 24/7 or while you're sleeping, your hand and forearm muscles are going to be tight and painful at some point. So same thing with our jaw muscles. So checking in that your teeth are not clenched. The second T helps you fight that, and that is tongue to the roof of your mouth. And so if you put the tongue to the roof of your mouth and you try to clench, good luck clenching hard. It's really hard. So throughout the day, just checking in, putting tongue to the roof of your mouth, and that can help you not clench. For nighttime, you may want to see your local dentist or physical therapist if they're skilled to do a night guard. And ideally, you'd be able to do a custom one, but there are plenty of over-the-counter, and that night guard can help with any teeth clenching or grinding at night as well. But it should help symptoms. Night guard's not for everybody, so if it's making it worse, ditch it. Your dentist can also make a retainer that, or orthodontist that sometimes can help with teeth alignment. So that's the second T, so relax. Teeth not clenched, tongue to the roof of your mouth to avoid clenching. The P is posture. So posturally, when we hang out like this, that puts actually a lot of strain obviously on our neck, but into some of those jaw muscles as well. And so it's okay to hang out there every once in a while, but in general, you want a nice chin tuck and tall posture. You can view our YouTube videos on those, as well as some of that neck strengthening. And the key while you do that is that you don't clench while you do it. So tongue to the roof of your mouth, nice and relaxed. And it's just 10 to 20% effort. You're not straining into that position. And then our strengthening exercises would help you build endurance in that position. Lastly is just breathe, and specifically belly breathe or diaphragmatically breathe. And so hands on the tummy, really thinking about breathing in and out. You can also put a hand on your chest to get that feedback. But in general, what that does is diaphragmatic breathing automatically stimulates your parasympathetic nervous system, which is your rest, digest, kind of calms everything down. Versus our sympathetic nervous system, we tend to be more of a chest breather, right? If you're running or stressed or anything like that, that one ramps up your sympathetic nervous system, which makes everything tense. 2, you're literally using your neck muscles and jaw muscles to help you breathe, and so you're feeding into that tension. So RTTPB, relax, teeth not clenched, tongue to the roof of your mouth, proper chin tuck and tall posture with a little bit of a shoulder blade squeeze, didn't mention that, building some of our strength exercises to get stronger there, and then that breathing. Then to specifically help with that TMJ tension, you can check out our other videos teaching some self-massage techniques, some opening and closing techniques, and then really the application is getting super strong and robust through your whole body, but specifically your core and your upper body, and being able to move heavy loads through your upper body with a relaxed jaw where you're not clenching, and that's where you can practice that neutral neck, tongue to the roof of your mouth, not clenching your teeth, incorporating your breathing and bracing, etc. So applying that RTTPB to your everyday life can be super helpful to start bringing down some of that TMJ pain and tension, and then check out our other videos related to TMJ to help too.